Hello and welcome everybody to the Agents of Change in Mental Health. We are here to have some powerful conversations to both empower and equip individuals in our communities to transform the mental health arena and communities through advocacy, education, and just providing you with innovation solution. And we are here because we share a very heartfelt vision to be able to see our communities and just the world to improve their mental and their emotional well-being. I have my incredible guests here, my colleagues, and who I like to call my sister friends. I have Miss Berta Chavez and also Miss Nancy Cowden. And they're going to take some time to introduce themselves and give you some really great information on who they are and why they're here.
Excellent. Thank you, Tamara. I'm also very much excited to share this space with you too, who are amazing clinicians. And yes, I concur with you that we just want to provide a really this space to use the tools that we know of to make just a positive impact and create that so needed community awareness on mental health, but especially this month that is Mental Health Awareness Month. So that's why we thought that this was a perfect month to go ahead and get started and touch base on those things that we talk about. So my name is Berta Chavez. I'm a licensed clinical social worker, and I'm also a bilingual and bicultural, and I've been in the field of social work for about 12 years. Very excited that chose this career. And many times we say that the career chooses us. And I think this was definitely my case. I had always felt an inclination to help and to serve others. And I found that a lot of my personal values are in perfect alignment with social work core values of dignity and service and social justice. So as I move forward in my career, I learn of so many experiences of people out there in the world that have gone through trauma, that have experienced different circumstances in their lives. And just, I had this fire inside me of wanting to do more than just be there for them, more than just a bystander. I always wanted to create change and to help others develop that interest as well of making change and not just know that something is wrong, but take action and make the change that are needed. That's just one of many different experiences.
I love it, Berta. And I mean, I can sense and feel your passion for this incredible work that you're doing. I loved how you shared that, how sometimes we find that we don't choose a career, but it chooses us. It's incredible. I always say to people, I really believe, ladies, that it is a great time to be a mental health professional. And I'm so grateful to be here on this incredible journey with you. And so, friends, we are now going to hold space for the incomparable Miss Nancy Cowden. Nancy, go ahead and take some time and share who you are and just share your passion and why you're here.
Absolutely. Well, I'm so excited to be here with you, amazing women, and for us to share this space and really get out there and bring awareness to different areas of mental health, of accessibility to mental health, raising awareness to help break the stigma of mental health, making mental health more easily accessible, and also supporting therapists with their mental health as well and the journey that they're on. We're in this helping field, but we hold a lot of space for a lot of things. And the experiences that we have on this journey, we need support as well. And so I've really had an evolution in my career. I've been in mental health now for 25 years. I'm a licensed marriage and family therapist in California. And I'm also a business coach for therapists. And I also have a mental health provider directory and booking platform that I created to help make mental health more easily accessible for people. And it's been like a real journey for me working in community mental health and then going into private practice and really seeing areas of the mental health field that there was a lack. and really looking to make some revolutionary changes in the field to help support people seeking mental health support and also those providing the mental health support. And so I'm so excited to be in this space with you amazing women and for us to really be working as agents of change in mental health for our society. So I'm so excited for this journey and what we can bring into the world through our collaborations.
I absolutely love it. Thank you so much, Nancy, for sharing your heart, your passion. And one of the things that I'm so grateful as we three are coming together to pioneer, right, this beautiful conversation and to bring these resources and talk about some of the things to help nurture and cultivate our communities and to taking care of themselves mentally and emotionally. And one of the things that I think was incredible, Nancy, that I so admire about you is your focus and your passion in helping us as the clinician. It is incredible. In the journey ahead, I'm so excited about it and just so grateful. We've got some powerful, powerful women who are skilled and who are passionate. I often share with some of my other colleagues in the field, ladies, I said, I think we're living in a time where there are many of us who, may have been called to the field, but there are those of us who are now leaning into doing the work and doing it differently with more power presence and using our voice, right? Because as Nancy shared, we see some of the challenges and Berta was talking about some of the things, and we're here to bring those solutions to raise the awareness just so that we can see change and transformation because I just believe we all deserve that.
I love that. And I think that we should also learn and hear more from you, Tamara, and the wonderful work that you're doing in your private practice.
Absolutely. So I am Tamera J. Brown. I'm a licensed professional counselor and an MDRIA trained EMDR therapist. My practice is located here in San Antonio, Texas, where I get the honor and the privilege of doing online therapy for amazing human beings across the state of Texas. I have been on this journey as a therapist, starting working as an addictions professional as a licensed clinical dependency counselor for all males prison facility. And I will tell you that along the journey, it's almost like how you got to find your sweet spot, right? And so I did all the things. I served men and then I went to the children's community. And this is where I salute you, Berta, because I'm here to tell you I had to find, you know, the people that I can play well with and support. And that is women. So women are at the heart of my private practice here in San Antonio. And it really is my belief. And this is another reason why I'm so glad that we are here having these amazing conversations. It's because I just believe that women are the wellspring. I believe that we are key to the wellness of our families, and we play such a huge role juggling so many things. And so I'm here to be the voice and to be the support for women and to help us to increase our resilience. And so some of the things that I am very passionate about as an EMDR therapist is helping people to move through and to heal mind, body, and soul, those tough adversities that we've been through to decrease the stress and just live with more peace, calm, and confidence. And so I'm so grateful to be here and so grateful to be on the journey with you all.
That's great. And I love how you mentioned the holistic approach, because I think that's something that we have talked about before in prior meetings and how important that is. And we don't realize how important it is to take care of our physical health, but also to take care of our mental health and so many aspects of our lives that many times are overlooked.
Absolutely.
And mind body connection is so key. And it's fascinating because so many people they view mental health over here and physical health over here, and they don't connect them and they don't see how they're interrelated. And you can't just people stigmatize getting, mental health support, but physical health support, they're quick to, if they have an ailment, go to the doctor, but not realizing we have one body and they're connected, they're interrelated, it all works together. And we need to support both. and really bring that holistic approach to taking care of our well-being. And so I love that we can interweave all of that into our conversations as well and really support people in seeing that, dealing with your mental health is part of dealing with your body and your well-being as a whole and nothing to be ashamed of.
Oh, Nancy, I absolutely love that. And I just think that again, that just kind of shares the heart of why we're here, right? Because there's so much that, people in the world, in our communities that we may not be aware of, right? And then why would we? You know what I mean? It's not like we're sitting around the breakfast table as we're journeying through life and talking about the mind body, connection. And that's why we, the therapists, are here. And so I would love for us to take just a few seconds, right, as we're doing this beautiful introduction to the revolutionary conversation that the Agents of Change and Mental Health is here to bring, and just have each of you to share just one thing that you hope to see happen, one area of change, even one of those stigmas that you're hoping that your voice will be able to bring awareness and plant seeds of change for. And so, Berta, if you don't mind sharing, if you got something to share on that, we'd love to hear from you.
One of my areas of a specialty is work with trauma survivors and specifically children and adolescents and families that are wounded by trauma. So definitely trauma is something that is unfortunately present in almost every age, race, ability, socioeconomic group. It doesn't discriminate, right? But we also know that it can increase the risk of developing mental illness, substance use, psychotic disorders, so many things that can happen when a trauma goes unaddressed. But it doesn't have boundaries, but there's a disproportion impact on marginalized populations. So I want to raise that voice too, that these things exist everywhere. Trauma is real. And if we look at data, if we look at statistics, most Americans died of gun-related injuries. In I think the Center of Disease Control reported that in 2021, this was the biggest year of gun-related injuries on record. And many of these are connected to mental health. So that's why these are things that we're seeing every day. We turn on the news, we hear these things happening left and right, but we're not putting one and one together as much as we should on how important it is to raise that awareness of mental health. And I love that we have prepared a lot of different interesting themes and topics on maybe things that we're not necessarily talking about often, like men's mental health, like how self-care impacts our work as therapists and as clinicians, as social workers, and all these different professions. So I am definitely very excited to see how all of this is gonna play a role once we get all these guests coming in, and then we're just very excited to bring a voice and have everyone connect with us and really raise this awareness that is so needed right now.
I absolutely love it. I think you said something that really pulled at my heartstrings too, Bertha, and that is the reality of how trauma, mental health, we usually hear about it with the big people, right? With the adults. We
Yes.
know men and women, but sometimes the children, who I like to call the little people, their voices are not often heard. And sometimes we're not aware that they are very much alive, living with mental and emotional things that we really need to give attention to, raise awareness on, and give our communities those tips, strategies, and solutions for that. Mhm.
And one thing too, so many adults, right, who are experiencing trauma currently that they're still dealing with are traumas from when they were children that weren't dealt with because these things weren't spoken about. Right? These things weren't dealt with, they weren't spoken about. Traumas happened and people, kept it in the home, right? And they didn't seek help outside to get support to overcome that. And so really bringing that awareness and making therapy a safe space for people to come to and process these things from a young age is just so important.
I love that, Nancy. And we want to hear from you, Nancy, and hear just one of the things that you would like to see, maybe one of the stigmas that you're very passionate about, or just a change that you want to see happen through this amazing collaboration. Yeah.
One of the things that I think is so important that I have found on my journey and why I ended up wanting to launch a mental health provider directory and booking platform was the struggle that people were having finding a mental health provider. So we talk a lot about fixing the stigma and encouraging people to get support. So then they're like, okay, let me go find support. And then they can't find a provider to work with. And in my practice, there was a point in time around 2019 or so where I was getting so many calls from people wanting support. And my practice was full. And they would tell me, you're the 10th person I've tried to contact, the 15th person I've tried to contact. Nobody has availability. Nobody takes my insurance. Nobody can see me. And it would just pull at my heartstrings every time, like, oh my gosh, this is just so devastating to hear that there are people seeking help and they can't find it. And they're going to give up and not get the help they need if they can't find the support. And, at that time I was thinking, okay, I could start 3, 4 private practices with all these phone calls, right? I don't want to, I'm only one person. And I'm like, okay, I could expand and do a group practice, but that just solves like the problem in my immediate area. I'm like, what can I do to really help increase accessibility to people to help make this process easier? And the means that were out there currently, I was like, this isn't working because it's leading to people going down these rabbit holes of not finding a provider. If we're going to talk about breaking the stigma, we need there to be providers available and easy to find to support people. And so that is what kind of led me to be able to start this mental health provider directory and booking platform. And from there, I was like, okay, but wait, we need providers to be able to support all these people. And that was when I got into doing business coaching and working with the providers to help support them, right? In creating their private practices, in ensuring that they're creating practices that are sustainable for them, that they're taking care of themselves, right? That they're not getting burned out, that they feel like they're able to make a sustainable living and are respected in the healthcare field, right? So there's a lot in that arena too, in terms of providers being able to support themselves and take care of themselves in every facet of that word. So I have a lot of multi-passionate interests when it comes to all of this, but definitely helping to bring awareness to mental health, breaking that stigma, making mental health care more accessible, and providing support to the providers who are giving of themselves daily and making, them feel supported on their journey as a mental health professional. So all
Nancy,
kind of
I
tied.
love yes, definitely so much to talk about that. But I just want to highlight something very important that you said, that I'm only one person. And I think that this work requires a whole community, right? Just like the saying, it takes a village to raise a child. We definitely need to be together on this.
Right.
One person can't make the necessary changes that we need. We need to collaborate and and get to that collaboration is one of our objectives with this podcast.
Absolutely.
I think that that is absolutely incredible. And I think the heart of why we're here is just really coming to light. For me, one of the things the message that I've been carrying throughout the year and made a very intentional decision on was that mental health is not a luxury and it is a real necessity. And we
Yeah.
sometimes, we can hear that and everything. And sometimes it can sound a little cliche, but what I really recognize is the fact that it's a common theme. It's a pattern, right? Of how we as human beings, because we get in the chaos and the busyness of life, And we often prioritize. We prioritize our relationships, of course, our jobs and finances, and we're putting all of these things and trying to do the best we can with what we know how to do. But it's time, in my view, for us to reprioritize and realize those things, those areas of their life, they are critical, they are important to us, but they are all streaming from the wellness of our life. There's a quote, I think it was Albert Einstein, that said that we cannot solve problems with the same level or the same kind of thinking that kind of created some of these issues and things that we're seeing. And sometimes we're externally focused, reaching to change situations and environments and things when the real change and transformation needs to be within, starting with the mind. And so I'm super grateful that we are here to do what both of you ladies have, we all have shared, right? That we're really here because we want to see families, children, men, women. We want to see our communities live with more fulfillment, more wellness and life, and overturning and really having these conversations that are sometimes not being talked about, right, in a way that sheds light on possibility and solution. And so I'm so grateful for us being here and want to give right opportunity on where folks will be able to find and connect with us with the new things that we're doing to follow along with this conversation.
Definitely. So we create this space and also will have access to a YouTube channel where people can definitely follow us and follow our podcast and our guests. And please just keep staying tuned because we have prepared different guests and topics that you will not want to miss. They are just incredibly important and it's going to be with all our heart, with all our passion, with all the fire inside us to really make a difference and get you the information that you need to create change.
I love it. And so we are so grateful, so thankful for everyone who's going to, or want to invite those who will come across this conversation today. Just share any conversations, any topics you would like to hear from us so that we can be very intentional and supportive of all of you and meet the needs of our growing community. And so, any last words that we want to share, anything you want to say, Bertha, to our listening audience before we part for today?
To stay with us and follow us on social media. We are going to definitely share our sites and our ways for you to continue stay with us and keep a mind and a heart open for what's coming as far as the topics that we have prepared and just come not just with a desire to learn more, but a desire to really apply strategies and apply changes and also help others that you know that may need access to that help. Our podcast is gonna be free of charge. So we want to make sure that we get access to all the communities and populations as much as possible to spread the word. So help us spread the word because this is important.
I love it. Yes. And then, Nancy, any parting words for our listeners today?
Yes, we are excited to have everybody kind of sharing the conversation with us, and we'll include the link to how to find us on YouTube, how to reach out to us with any comments, any suggestions of what you would love to hear us talk about, anything, any topics that you feel would be, wow, I'd love to hear their thoughts on this, or I need support in this area. Love to hear your thoughts, your feelings. So we will include that information as well. So if you're finding this video, then that information will be there for you to kind of see all the places where you can hear us, see us, reach out to us, and be part of the conversation, right? Because we're here to support the community, right? And support mental health. And so we want everyone to be a part of this and we want to make this beneficial and useful to everybody. So be part of the conversation. We would love that.
So grateful, so honored to be here, to be moving through time space with you, with both of you ladies, and with our growing community. I'm so excited for the journey ahead. My little last parting words is to remember that caring for your mental health is just as important as you caring for your loved ones and even your physical health. So don't be afraid to reach out for help. We are here to support you and bring you those tools, strategies, and the information to lead you to living a life of wellness.
Beautiful. And
Absolutely.
also remind you that we will be having our next podcast coming soon. And stay tuned. It's going to be related to men's mental health.
Such
Yes,
an important topic. I'm so excited for us to adjust this one.
so
Thank you,
excited for the
everyone.
journey.
Thank you. We'll
Thank
see
you
you
all so
soon.
much. Bye.